family medicine, sports medicine, and orthopedics for over 15 years in many capacities. She is a physician owner of Balanced Physician Care, a holistic direct primary care medical service in Ponte Beach, Florida. The practice provides a unique solution for individuals and small business owners who are seeking answers to better, more personalized care. She is board certified in family practice and has a certificate of added qualification in sports medicine. She was a former team physician for the Chicago Red Stars women's professional soccer team. Completed a fellowship in integrative medicine at the University of Arizona and has received her acupuncture training at the UCLA Physician Certification Program. She currently lives in Jacksonville Beach with her husband Mike and 4-year-old son Lucas. Please welcome Dr. Sharyl Truty.
Take this just in case I need it. Most times I don't. So, well, thank you very much for that warm introduction. I really appreciate the opportunity to talk to you guys here today. I'm going to talk about a subject that's near and dear to my heart. It is because I started my practice based on that. About 2.5 years ago, I kind of got burned out on healthcare. I wasn't able to provide care in the way that I felt that I needed to or wanted to for my patients. So as I was looking around for a business solution to start a practice, I started and decided to base my practice on a direct primary care. So I don't know if any of you have heard about it, but I'm sure a lot of people have heard about the concept. Regardless of whether you are a financial advisor or whether you are a friend who has nieces or nephews or neighbors who are facing the healthcare crisis and trying to figure out what to do, I think it's important to know about direct primary care because I think it is sort of changing the healthcare landscape. When I first started about 2 years ago, there was only about 600 practices throughout the country that were doing this type of model. Now there's over 1,000. So it's growing, and the question is, why is it growing and what does that mean for you, whether you're in the business of healthcare or whether you're involved in it? It's on the mind of your legislature. In January, the Florida legislature passed a bill about direct primary care in January, and right now our federal Senate is holding hearings on direct primary care. So it's around and it's about, and it's important. So what exactly is it? I mean, in the purest definition, it's simple. It's membership medicine. For a monthly fee, you basically get a set of services that your physician provides. Pretty simple. It sets itself apart different from concierge medicine in the fact that often those monthly fees are much less, but also there is no third-party billing. So a lot of times in concierge medicine, they'll also bill an insurance plan as well. With direct primary care, the definition is that it is only sort of this membership fee. And if that was all direct primary care was about, I don't think it would answer the question really why it's growing. There's a lot more details to it. So in order to understand it, let's talk about what kind of coverage people have and what you have. How many people here have insurance in which they have a deductible that's $2,000 or higher? Yeah. So if we look, that's about half the room. And so healthcare is changing in that sense. According to the CDC, in 2016, 40% of people have a high deductible health plan. And that's up from 2011 when there was only about 26%. If you add that up with about 10% of people who are uninsured, you're looking at almost half of the people are paying out of pocket now for health care. They're not using their insurance, they are paying cash. And I think that that is beginning to change the landscape of health care. Because people are asking, what are we paying for? What should our experience be like? So let's be honest, this is more a rhetorical question. I mean, how many of you really probably avoid the healthcare system at all costs, right? When you get sick, what do? You probably go to the internet first, right? And see if you can figure out what's going on. Or, you ask a friend or a neighbor, or maybe you talk to another healthcare provider that you know. But you avoid it at all costs. And why is that? Well, the experience pretty much stinks, right? I mean, if you want to get in to see your physician, you probably have to wait a couple of weeks to really get in to see your own physician. And then once you get there, you're waiting at least 45 minutes, right? And then when you see them, that only leaves maybe about 10 minutes, of time. And if you've got multiple things going on, this is sort of what you're facing. And on the provider perspective, that doesn't leave much time. It only leaves time for a prescription or a referral to a specialist or a diagnostic test, and then you're kind of out the door. And then you have this piece of paper, and do you get much of an opportunity to shop? You really don't. I mean, you're told, okay, this is where you should go, but if you're paying out of pocket, do you know that that place that you're going is going to provide you the best value? For a lot of people, those answers are no. So direct primary care asks the fundamental question, can healthcare be different? Should it really maybe be different? So that's what sort of makes direct primary care unique, is it's kind of going back to the concept of personalized medicine. The physician in that type of a practice is going to get to know you really well. We're not going to have a huge panel of patients. There's going to be a smaller panel of patients, and they're going to get to know you very well. That also means that they're going to be able to take care of you, and they take care of you 24/7. So if it's a weekend and you have a problem, you're going to be able to call the office and get solutions and get directions. For most of us in the typical system, that really isn't a possibility. And the question is, does that lead to better care? If personalized medicine, that seems to me to be a no-brainer. If the doctor knows you better, that would lead to better care. But some of the practices and networks that have been doing this out west have actually done studies. And the studies show that this type of practice leads to 35% less hospitalizations, 82% less surgeries, 65% less emergency visits. So yes, personalized medicine does lead, in fact, to better outcomes in your health. So how do we get beyond more than just personalized medicine? Direct primary care offers very convenient care. So most people in my office don't wait any more than 10 minutes. And we're able to integrate modern technology easier. We're able to come into your homes with telemedicine visits and phone calls, which in a traditional mode of practice is really difficult for a physician or a provider to be able to do, because there's just no reimbursement sort of matching for those type of services. And we provide a lot of coordination so that if you're trying to figure out where you want to go for the best value, we help to provide those services. And then the last thing I think that's really important that has caught a lot of people's eye is cost efficiency. So again, if you're paying out of pocket for your health care, 40–50% of people are, you want to look for value and you want help in kind of going around your local community and finding that value. So for a flat fee, you basically know what you're going to get. You're going to get all your primary care visits and all procedures. But we also kind of spend time talking about, okay, this is your prescription. Where do you go in the community to get that for the best value? We talk about radiology. Before you leave, we know that's part of our job in a direct primary care practice, is to know what cost is for these different services and where you can go if you want to make that choice. And we also provide a specialty consult service, so that if people think, we kind of think between the two of us that we may need some specialty help, but we're not sure, we have access to that. So we really believe that direct primary care, provides the solutions. We believe that medical care should be personable, convenient, accessible, and our goal should be to avoid unnecessary testing, save you time, and save you on medications. So the biggest question that I often get asked is, okay, this talks a lot about outpatient medicine. How does that work with insurance? So direct primary care can work, first of all, with any insurance. For those people that have employed health insurance with a low deductible, this can be a solution because of the convenience aspect of it. For people who have no insurance, some people, unfortunately, in this way of things are now with healthcare, choose to go with no insurance. And so they use this sort of as their kind of home base, and then they decide to save for those catastrophic needs. It can go really well, as I said at the beginning, with high deductible insurance, because then people just add on this extra monthly fee, and then they sort of get this complete care coverage package with that extra personalized touch. But part of my talk today was to talk a little bit about how there might be a unique solution here to people who are sort of facing an issue. If you've ever shopped for health insurance on an individual level, you'll know there's not a lot of choices out there for individuals. So there's something called a health share. I don't know if any of you have heard of a health share before, but this is something that really wraps around very well with sort of this membership direct primary care medicine. It's not health insurance, but the concept is very similar. Basically, it's a group of individuals who agree to come together to pay one another's health care bills. It grew out of the Christian church sort of movement. It started originally there, but now it's grown to be, these groups are of huge, large proportions, and they span several states. And basically, you pay a monthly sharing amount to that group. There's all different types of plans. And then when you do have a catastrophic event or you have a bill, you submit that to the group, and then they pay that bill. So there's a lot of subtleties around that, but that's sort of it in a nutshell. These are the 4 biggest health shares that there are out there. We talk to a lot of people about Liberty Health Share because they recognize sort of that cost efficiency of direct primary care, and they actually reimburse their members for the monthly, a portion of the monthly membership. So if you're interested in learning more about that, if you haven't heard, I have an email list on the table. Give us your email and be happy to send you more information about that. So that's what I think makes this to be a unique option for people. The last part that I just wanted to talk about is how direct primary care can be a business solution. So for some small businesses, you can't afford to give people insurance. But here's something, whether it's to your employees or maybe just to your executive team, something in the healthcare realm that you can give them that would be a benefit to them. So this membership, a lot of times across the country, is used sort of as providing that healthcare benefit. It also can be a benefit to large companies. For those of you in the financial and insurance world, you know about self-funded plans, and for large employers, this can be an option for saving on healthcare is to become involved in a self-funded plan. And a lot of people are coupling the direct primary care membership with the self-funded plan because the membership, again, provides the cost efficiency, and so that provides people money back, and so that that employer can then use that money next year, again, for health care. So if anybody wants to talk more about that, I'd be happy to speak a little more on that as well. So again, that's direct primary care, I think, in a nutshell, is that yes, it is about membership medicine, but at the core of it is providing personalized medicine, very convenient care, access everywhere, and then price transparency, trying to solve these healthcare solutions. And again, coverage types can be almost anything: insurance, high deductible plan, or even no insurance. So that's that's everything. I really appreciate the opportunity to be able to talk to you here today. If any of you have groups that you think might benefit just from learning about this, trying to get the word out about what this is and for people to be able to make a choice. This is all the things that we do at our practice. I do a lot of holistic medicine, obviously acupuncture and sports medicine, and that's all part of our membership. We're actually, though, rolling out a new membership level for people who are just looking for only primary care. So I put brochures on the table. If anybody has any interest, we have some upcoming webinars that we're going to talk about that. But again, we have sort of two levels for people based on, how much care that they feel that they need. So thank you very much for having me here to speak today. I don't know if we have time for questions.
Let's open it up for questions.
Yes.
For those of us who are approaching 65, on either side, how do you relate to Medicare?
So each individual direct primary care practice handles Medicare differently. At our practice, we have a membership fee, and so we ask Medicare patients to join. We bill Medicare as well, and we do the small fee for non-Medicare covered services. So that's what we do for Medicare folks. There are some direct primary care practices that don't accept Medicare at all, and then you just pay them a fee. Yes?
For the individuals that have high deductible plans, is your membership fee used towards that deductible and recognized by the insurance company?
That's part of the reason why there's legislation going on right now in the Senate, is to sort of get that to be recognized. Right now, there's ways that we can do that. It gets kind of complicated, but when you come into the office, we can sort of generate a bill that is the value of what that visit would be. And then right now, some people will submit that for reimbursement to the insurance, and they can get reimbursed. Not for the monthly membership fee, but for when you come in on a traditional model, what that equivalent would be. Yes?
Yeah, when I was in the legislature, I was a big champion of this direct primary care. That was back in 2013. Obviously, it took 5 years to finally get it passed. And it's great to see somebody actually setting up a program. It seemed that a lot of patients are having these high deductible plans that really only take care of the catastrophic care. And we spend a lot of time in regular practices on billing and referrals. There's a lot of staff that costs. I assume you're saving money by not having to have as many people doing that for you. My question is, how many patients do you anticipate taking care of in your office or online a day?
The averages are going to be dependent upon how many people you decide as a physician you want to be a part of your practice. So most practices will try to cap out at 600. And so that can average, somewhere around 9 to 10 patients a day. So most people know that an average physician will see 30, sometimes upwards of 40 a day if you're seeing patients every 15 minutes. We're sort of at about a 10 and maybe up to 12 or 15 on a really busy day. Yes?
Is there a flat fee for the membership, or what are the basics and outlines of the membership? Yes, we charge one flat fee, and it's in the brochure. So for us here, our flat fee has traditionally been $125 a month, and that's because of all of the holistic care that I include as part of that sports medicine care. We're rolling out a new membership level at about $69 a month for people who just really need sort of that basic, occasional visit type of care, but appreciate the importance of having the doctor at their fingertips. I answer a lot of emails, and I answer a lot of emails on weekends. So I'm around and usually available for everybody. Yes?
You were trained at UCLA and then went to China for acupuncture. and I've always heard about it, read about it. Can you spend just 2 minutes how you benefit from that, what it is?
Sure, and at some point, I could always do a talk on that in itself. But yeah, acupuncture. We really think from a Western standpoint. I'll take it a stance here that it works on the parasympathetic nervous system. So people who know we have the flight or fight response, but we think that acupuncture really sort of stimulates that relaxation response in the body, and that we think it changes pain from the areas of the brain, and we think it actually stimulates the inhibitory neurons of the brain and of the spinal cord to reduce pain. So that's how it works on both organ systems for things like fertility, GI issues, stuff like that, and that's how it works on pain for issues like migraine, headaches, or back pain. There's some great evidence for it working extremely well in migraines, equal to taking a pill every day, prescription.
Sure.
Yeah.
If I were an elite athlete like Rob Sturzberg, and I was going to be the best golfer like Rob, and he was having shoulder injuries. Is that obviously that's part of your sports?
Yeah.
You'd be able to help Rob.
Yes, I would. No, for me.
Uncle.
For all those golfers out there who want to improve their sport. No, I mean, for me, with my training in sports medicine, and then I did training in nutrition, sort of part of what I do uniquely is that I have sort of all that training in those perspectives to take care of an athlete from both a musculoskeletal standpoint, improving their performance, utilizing things like acupuncture that haven't normally been used, and being able to take care of them from a nutrition standpoint. How do you maximize nutrition in order to maximize results? So thank you for that plant of a question. I appreciate that. Yes.
I think it's great what you're doing and trying to understand everything that you're doing holistic with nutrition and hormone. What is the difference between what you're doing and functional medicine?
So that's a really good question. I get asked that a lot. So we'll look at it often as it's sort of overlapping in a sense. Technically, there's two separate, there's integrative medicine and functional medicine, but most of what we do is pretty similar. Integrative medicine, it maybe has a little bit more of a foot as well in traditional medicine, so they're trying to blend both the holistic medicine along with giving you a traditional perspective as well. Functional medicine has a lot to do with saying that the gut is the basis of a lot of disease. I incorporate that philosophy in what I do as well, but probably in functional medicine there's maybe slightly more of an emphasis of that. But otherwise they're pretty much very, very similar from a nutrition standpoint and a holistic standpoint. Yes?
So I noticed in the brochure it says that you don't have long-term commitments on this. What is a typical term of somebody if they were going to sign up for this?
So we decided we want people to feel really comfortable with this, and that if they decide that they don't want to do this, that's fine, So we just have a 90-day commitment. So if you join, if you decide in 2 months that this isn't right for you, you just give us notice. We have you pay for 90 days or 3 more months, and then you're out of the contract. Other direct primary care practices can do a year. Some people do quarterly. A lot of people, though, do 90 days because, again, most people, once they kind of experience it, they can kind of feel the difference, and it speaks for itself. Well, thank you very much.